Bismillah ar-Rahman ar-Rahim. Today we will discuss the chapter of instruments. Number one, we finally diagnose a patient according to our periodontal charting to gingivitis or aggressive periodontitis or a chronic periodontitis, and we started to put the treatment plan for this patient. This patient is different from your diagnosis patient. The diagnosis patient, you diagnose the dentition problem or the dental problem, if it is endo or perio or medicine or crown or bridge. In this short, this is a periodontal problem. So we will put a treatment plan. Treatment plan is composed of phase 1 periodontal therapy, phase 2 periodontal therapy, phase 3 periodontal therapy, phase 4 periodontal therapy, as we discussed it in the periodontal chart. Phase 1 periodontal therapy include complete removal of the calculus, correction or replacement of poorly fitting restoration or prosthetic device, restoration of carious lesion, orthodontic tooth movement, treatment of food impaction areas, treatment of occlusal treatment, and extraction of occlusives. All of this in the phase 1 periodontal therapy to change the patient from this position to the pink state, from this to the pink state. If these tools are not in ordinary manner, need orthodontic treatment. If there is a poorly fitting bridge or a poorly a poor restoration, you need it to be corrected to reach to this state or this pink state. And in this state, you can put your scalpel and start your phase 2. Start your surgery. You cannot start surgery at this situation because there is more inflammation, more bleeding, and more morbidity of the surgical site. Also, the overhanging margin like this must be corrected in the phase 1 therapy to reach our pink state. Periodontal instrumentation or periodontal instrument include assessment instrument like the periodontal probes and the active rulers, include calculus remover instrument like scalers and the curettes and periodontal files, ultrasonic and sonic instruments, periodontal endoscope, cleaning and polishing. First of all, we need to identify the instrument. How we can identify the instrument? The instrument composed of handle and the shank and the plate. The identification of the instrument is written in the handle like this. For example, it is a Gracey. Gracey is a type of instrument, and also its country printed on the instrument, and then its size. This is size number 1, and this is size number 2, or in a linear manner or in a horizontal manner like this. This is the handle. Each instrument composed of handle and the shank and a plate. At the market, there's a variety of instruments. So how can I select the right instrument? You will find this instrument with a small cross section, this with larger cross section, this with larger cross section, this is with larger cross section with a plastic pads. Okay. Also, the price, it's a price different. Which one of this is more easily to be applied and more comfortable to my hand? Unfortunately, this or this. This is the difference in the price also. Because of this, it is a hollow. It is not hollow instrument, so it will be much heavy and its small cross section. Its small cross section will be different in application. Need more forces from your hand to apply its action. This is for this, but this need light forces or not need more forces to apply its application. Also, if you need to choose an correct instrument, you should choose the balanced instrument rather than the unbalanced instrument. The unbalanced instrument, when you draw an imaginary line from the handle to the blade or the blade, you see the blade is offset of this imaginary line. So most of your forces will not be applied to the blade, or you need to exert more forces to apply action. Rather than the balanced instrument. The balanced instrument, when you draw this imaginary line, this imaginary line fall on the blade. So you will exert all your forces, or all your hand forces will be turned automatically to the blade and perform its action. The shank, you should know, we have a straight shank or a simple shank and a complex shank. That is because we need to apply the straight or the simple shank at the nearer area like the facial view and the proximal view of the anterior teeth. But in the posterior teeth, a premolar and the molar, we need a more complex shank to reach the surface or the long axis of the surface. And we have a rule. When you, as we told you before, that the instrument has a handle, and a shank and a blade. The shank has two portions. This is what is called the functional shank. The functional shank is from the end of the blade to the end of the shank here. But the lower or the terminal shank is from the end of the blade to the first bend in the shank. Okay, and so here we have a rule. The rule here is the lower shank must be parallel to surface to be instrument. Keep this in mind, and we will consider it again. So as this an instrument, we have, this is all the shank, and this is the functional shank. The functional shank, yes, with the yellow part. The yellow part is the functional, but this red part is the lower shank or terminal shank, that when we need to apply this shank or this instrument, we need the lower shank parallel to surface to be instrument. So we will start at the instrument. Number one, it is the assessment instrument. Assessment instrument or the measure instrument. Number one is the explorers. Explorers, we ordinarily call it probe. No. It's not probe. It is explorer. This is explorer. But as a probe, this is a probe. This is a probe for measurement. Okay. Number one, we will take the Marcus colored probe by 3 millimeters. This is a 3 millimeter, then another 3 millimeters, then another 3 millimeters, another 3 millimeters. Number two, this is important, this is a UNC probe. According to UNC, the University of North Carolina, that is advanced by University of North Carolina. Started from 1, 2, 3, 4, then a black portion measured 1 millimeter from 4 to 5, and the same like this. University of Michigan probe with Williams marking. This is ordinary probe. We will use it. Okay. This Williams probe or Michigan O probe measures the 1, 2, 3, then 5, then 7, 8, 9, 10. 1, 2, 3, 5, 7, 8, 9, 10. A small portion, a small portion, a small portion, then a larger portion measured 2 millimeters, then a larger portion measured 2 millimeters, then a small portion, small portion. Why? Why we put this Williams marking at this manner? Because it will be confused to your eye if this is from 1 to 10 pi 1 millimeter. So when you started to insert the probe, you will try, if it is 1 millimeter, you will try to calculate the rest. It is 5 or 6 or 7 or 8, but at this manner, at this manner, 1, 2, 3, 5, 7, 8, 9, 10. If the probe is entered and we have 2 large markings and 3 small markings, this is 3 millimeter pocket. If we have 1 large marking and 3 small markings, it is 5 millimeter pocket. If the 2 large markings is disappeared inside the pocket, so it is a 7 millimeter marking. So it is for easier application. Then the Goldman Fox probe, it is like the Michigan O probe, but is flattened. And this is the Michigan O probe with marking 368. And the WHO probe referred to World Health Organization, which has 0.0 millimeter pole to millimeter pole at the tip, and the millimeter marking at 3.5, 8.5, and 11.5, and color coded from 3.5 to 5.5. This small pole is to avoid hurting the periodontal or the base of the pocket or the junctional epithelium. And finally, the nipple probe to detect the furcation area, and the nipple explorer is the same like this. Plastic probe for implant. So we will change it to the scaling instruments. Number 1, supragingival scalers and subgingival scalers. Supragingival scalers include Sickle Scalers, Morse scalers, surface scalers, and Cumming scalers. A Sickle scaler like this, and its action mainly interproximal like this. Has a unique characteristics, is triangular in shape and has double cutting edges and a pointed tip. And concentrate on this pointed tip. Pointed tip will differ between the curettes that has a 2. Yes. 90 degree between the face and the lower shank. You know the lower shank? Yes, this is the lower shank. It is a part from the plate to the first bend. It is the lower shank. Okay. But what is the face? This is the face. Face of the plate. Face of the plate. Okay. So here it's unique in the scaler. The Sickle scaler is 90 degree between the face and the lower shank. It's used for the supragingival calculus removal. Morse scalers is like this, okay, used in the mandibular anterior areas, but it is, I think it is present in our department. Allah will see it. The Cumming scaler for removal of calculus and granulation tissue during a flap. Subgingival scalers like the Who scalers and chisel and periodontal files. Periodontal file just like the bone files, but smaller or in the periodontal aspect. This is part is small to be inserted between the gingiva and the tooth, not large like the bone file or of the surgery. And then diamond coating file like the pearls to be used to softening and smoothing of the cementum. Chisel scalers designed for proximal surface of the teeth to closely spaced to permit the use of outer scalers. So take a rest, then we will continue to the most important part in this section. It is curettes. Yes. The curettes is another instrument used for removing of deep subgingival calculus. Okay, for root planning and removal of mere areas. It's a very important instrument, and you will see outside college that many doctors does not use the curettes for his ordinary work. It is completely wrong because the usage of the Sickle Scalers and the use of the ultrasonic scalers is easy. Yes, but this instrument cannot be inserted between the tooth and gingiva, and cannot be inserted to, for example, 5 mm pocket. So the curettes here is very important, and there's many cases that worsen because his doctor doing the ultrasonic scaling and the ordinary sickle scaling without using curettes. So the calculus is present subgingivally and starting the sequence of the bone loss, and we will facing finally lose tooth. So the curettes have a unique characteristics. This has a round two, not tape-like scalers. No sharp points can be inserted into teeth pockets with minimal soft tissue in the cross section. It is not triangular like the sickle, but spoon-shaped blade like this. This is the comparison between the scaler and the curette. You see, this is a tape. This is tooth. This is the cutting edge. This is the face. Scalers, you see, scalers remove the supragingival and the curettes remove subgingival. You see the scalers not adapted like the curettes. So the curettes is classified into a universal curettes and area specific curettes. So universal curettes is have cutting edges that may be inserted in most areas of the dentition and have a 90-degree angle to the lower shank, just like the sickle scaler, and the blade is curved in one direction. Okay, we see. You see the face between the angle between the face and the lower shank is 90-degree and have two cutting edges, just like the most ordinary or the famous Columbia curettes. Famous Columbia curettes. This is 3 curettes for all the dentition. 13 on 14 to R to L for the anterior and 4R for L for the posterior portions, like this. You see? Okay, this is the Columbia also. We will turn to the second one. This is the area specific curettes. Area specific curettes from its name, area specific. So this is curette for an area. This is curette for another area. Okay. As we see, the Gracey 1 and 2, or the area specific Gracey 1 and 2, and the Gracey 5 and 6, and the Gracey 3 and 4 for all surfaces of the incisors, including the canal. The Gracey 7 on 8 and the Gracey 9 on 8, 7 on 8 and the 9 on 10 for the buccal and the lingual surfaces of the premolars and the molars. The Gracey 11, 12 and 15 on 16 for the mesial of the posteriors, and the 13 on 14 and 17 on 18 on the distal of the posterior piece. So what is different between the universal curette and the Gracey curette? We have many different, and this is the first important question in this chapter. What is the difference between the universal curettes and the Gracey curettes. You see the universal curettes, the face between the angle between the face and the lower shank is 90 degree, but this we have an offset blade or we have offset angle, okay? Offset is offset different from the set, offset different from the set. So it has a 70 degree between the lower shank and the face, and they have a one, because we have this angle, we have a one cutting edge, not like the universal curette that has two cutting edges. And this is an important comparison between the Gracey curette and the universal curette. This is used for a specific surface. This is a universal used for all surfaces. The cutting edge is one cutting edge. This is two cutting edges. The cutting edge curvature curved into two planes. This is curved into one plane. The blade angle offset blade 70 degree. This is have no offset 90 degree. So, what is the sequence of the Gracey curette? Gracey curette we have first was 14 instruments. Instrument number 1, number 2, number 3, number 4 to 14. So if the periodontist need to do scaling and replaning for the entire dentition, we need to use 14 instruments. But now we turn it to 7 instruments and double-sided, 1 and 2, 3 and 4, 5 and 6, 7 and 8, 9 and 10, 11 and 12, and 13 and 14. And by 1990 or 1980, we have a modifications 15 or 16 modification of 11 on 12 and 17 or 18, a modification of 13 on 14. So we see this is 1 on 2. This is 3 on 4. 6 on 7, 5 on 6. 7 on 8, 9 on 10, 11 on 12, 13 on 14. The 1 on 2 for the anteriors and the 3 on 4 for the anteriors. You see here when you go posteriors, these angles will be more acute. You see, these angles will be more acute. You see, the 1 on 6, 1 on 2, it is simple. It is more acute. 5 and 6 more acute. 7 and 8 more acute. You see 9 and 10 different from 1 and 2. You see the acuteness nearly to be 90 or right angle. You see 11 on 12 is the same or has the same shape on 5 or 6 but has a complex shank here. You see this is the first bend, this is the second bend. 13 and 14 have a complex shank also. This is the first bend and this is the second bend. You see? Okay. So that we have here a 1 on 2. You see the simple design, 3 on 4, simple design, 5 on 6. Okay. So 1 and 2 is the same like 3 and 4 is the same like 5 and 6. But the difference here for this acute angle and this it is more acute and this it is more acute. Okay, so the acuteness of the angle increase by increasing its number or increasing its work to the area. The difference between 1 and 2 also and 3 and 4 and 5 and 6 is the length of the lower shank. As you see, this is the lower shank. It is here is shorter than the 5 on 6. You see, shorter than the 5 on 6. So that when also you go for the posteriors, the lower shank will be increased or the complexity increased. Okay? This is the same. Okay, 11 on 12 and 15. 15 on 16 is a multiplication of 11 on 12 with a shank of 13 on 14, 13 on 14, and 17 on 18. 17 on 18 modification of 13 on 14 with a terminal shank elongated by 3 millimeters and more accentuated angle of the shank. Okay. When we identify any instrument, we will say like this: is a Gracey Curette or 1 and 2 Gracey Curette for curettage of the all surfaces of the anterior tooth. Okay, for example, 9 on 10. Yes, the 9 on 10 Gracey Curette used for scaling and troop planning of the vocal and the lingual aspects on the posterior. Okay, as we see, the 1 on 2 and the 3 on 4 and the 5 on 6, all of this is do nearly the same job. 1 on 2 for the incisors, 3 on 4 for the incisors, 5 on 6 for the incisor and the premolars. So we can use 5 on 6 instead of 1 on 2 and the 3 on 4. Yes. And 7 on 8 and the 9 on 10 do the same project. So we can select one and we will not using the other. But 11 on 12, it is a unique, and 13 on 14 is a unique. So we will get to the second question or second important question in this portion, that in this chapter, we can use the reduced kit or the reduced set of Gracey instead of the full set. Yes, the question is, what is the reduced set of Gracey? It is a 5 on 6 and 7 on 8 and 11 on 12 and 13 on 14. Okay? So that after we use all the instrument, we have a problem. What is the problem here? It is the deeper pockets more than 5 millimeters. So the factors modify the Gracey Curette to what is called extended shank instrument or after 5 curve. After 5 means that it is inserted after 5 millimeters pocket or in the deep periodontal pockets of 5 millimeter or more. The terminal shank is elongated by 3 millimeters and the plate is shortened. Like of this, you see that is 13 and 14. 13 and 14, and this is the modification in the 13 and 14. It is the same, but the lower shank is much more longer to get the deeper areas. And for the deep and narrow pockets and bifurcations and developmental grooves, the line angle and deep and tight pockets, we will use a mini 5 or have a blade or a small blade to be inserted in the line angles and deep areas called the mini 5. Curved, the curved are modifications of Gracey. This is most important. 15-degree short blade increased blade curvatures, longer terminal lengths, this. Lingers also a set other than the Gracey Curettes present also in the market. The same like the universals, resembling the universal Curettes, 11 or 12 for the posterior, 13 or 14 for the posteriors, and 5 or 6 for the anteriors. This is the Langer Curettes. Then the plastic instruments for the implant and the perium drivers like this to get the broken instruments. The ultrasonics and the sonics is ultrasonic from ultrasonics used for removing a plaque and the scaling and decurting and removing a stain. The vibrations in the ultrasonic will and the vibrations in the ultrasonic tips, it is to 45,000 cycles per second, from 20,000 to 45,000. Vibration in the sonic and from 2,000 to 60 to 6,500 cycles per second. The polishing instrument for removing a stain and smoothing two surfaces using the rubber cups and dental tapes and Bristol brush and the air powder and the periodontal files, see, and I'm putting the files. All of this used for scaling and root planning. So we will finish phase 1 therapy and turn to phase 2 therapy. Phase 2 therapy is periodontal surgery. We need a periodontal surgical instrument classified as excisional and incisional instrument, surgical curettes and the sickles and periosteal elevators, and surgical chisels and surgical files and surgical and needle holders. Incisional and excisional instrument, including knives, gingivectomy knives, and interdental knives. Gingivectomy knives like the Kirkland knife, and interdental knife like the Orphan knife. The Kirkland knife has a kidney shape like this, and this is the Orphan knife has a spear shape like this. The gingivectomy knife or the Kirkland knife is a kidney shaped knife used to remove the or used for gingivectomy, and the interdental knives like this, spear shaped knives used for also gingivectomy and removal of the interdental tissue. For the Barkal plate number 3, we used it in our ordinary work. Scalpel plates of different shapes and size used in periodontal surgery. The most common is plate number 10 used for extraoral incisions, and plate number 11 for stub incisions, and number 12 for inaccessible areas, and the 15 is the most common used in the intraoral surgeries. And our lovely periodontal 15C, you see the difference from the 15 plate and 15C plate. Its plate is much more confined in its size to fit the papilla and to fit these sensitive areas. Surgical curettes and the sickle. This is just like the larger and heavier curettes, and the sickle for removal of granulation tissue, just like this. Here we have a wide blade and a turner shank by 20 millimeters to used to remove of the granulation tissue. And then a periodontal elevator used to reflect and move the flap after the incision has been made for the flap surgery. Okay, the periodontal elevator have two surfaces, a concave surface and a convex surface. The concave surface is towards to the tissue, and the concave surface is towards to the bone. Okay, to remember it, we will give you an example. If you try to peel off an orange, okay, with a spoon, peel off an orange with a spoon, you will use a spoon to peel off the orange. So you will, the convex surface of the spoon will be outside, or will be peel off the orange, and the concave surface is towards to the entire of the orange, just like the periodontal tissue. So the convex surface is towards to the flap, and the concave surface is towards to the bone. The tissue forceps is used to hold the flap during suturing. It's like the tweezers, but here is more rough. The surgical files, like the Sugarman file, periodontal file, serrated like this, conical in shape and serrated like this, to be used interproximally to push and pull application to remove the granulation tissue, and octopinate chisel used with semicircular indentation on both sides to remove the pony ledges. Okay, and this is semicircular portions to be engaged around the tooth. Surgical scissors, we use a teeny scissors like this, and the castrigio also, and also the needle holder, a small. After we use all this instrument, we need will be dull, and we need to be sharpened, and I will let you with the sharpening video.
So we are going to start with the anterior sickle. I'm going to make sure my arm is resting comfortably on the countertop. I'm going to hold the instrument in my non-dominant hand, and I will be positioning, this is a H67, so the terminal shank is this part here. It's where the blade ends to the first bend in the shank. So I'm going to put this terminal shank right here at the 90. And I usually try to keep the blade right at the V of the guide. Now, if you don't have a guide, you can make up your own guide. It's easy to do. So you just have your terminal shank is at the 90. The toe is toward me. And the reason why I say that, because some people tend to move the instrument up like this, and it's pointing up. So you don't want to do that. You want to keep it towards you. And then the face is automatically parallel to the ground as well. I'm also resting my instrument on the countertop. And I don't have, I call it the death grip, because I see so many people and they have everything so tight that it makes the whole sharpening process a very exhausting thing to do. So just hold it nicely, but you want to apply pressure here so you're stabilizing the instrument. Again, my arm is resting. I'm going to use the edge 2, which is the coarse side on one side and the fine medium on the other side. And I'll hold the stone with my thumb on one side of the stone and my 4 fingers on the other. And sometimes you can, if you feel you're more comfortable to have the stone with your pinky underneath, you can do that as well to stabilize. So with the H67, it has a bit of a flame shape. So what you want to do, I don't want to just stick to the 110 here. I want to tuck in a little bit, and I'm going to apply heavier pressure going down, lighter pressure coming up. And I'm doing the back, middle, and the toe, ending it on the toe. Now, because this is a coarse stone, I'm going to turn the stone, and again, I'm going to finish it now with the fine medium side. If you're just maintaining your instrument, you don't need to do the coarse side. And that's that. I'm going to test for sharpness. I test the back, the middle, and the toe. So that grabs on very nicely. If it was sliding like this, then you know it's dull. But if I had this back part here and it was sliding, I would redo the entire blade. I wouldn't just sharpen the back, you have to redo the entire thing. So now we will do the other side. And I'm holding the stone the same way. I've seen a lot of people try to hold the stone like this, and if you could try to not do that, try and break that habit, because once you do like this, you're not applying equal pressure to the stone, and also you can ruin the toe of your instrument, and you have a hard time manipulating the stone around the toe. So it's a good idea just to have your thumb on one side, your fingers on the other, and you're holding it so that there's still 1/3 of the stone that's free. You're not up here like this, you're holding it down just a little bit. And again, I'm applying pressure here, and I have the back, middle, and the toe, and the back, and the middle, and the toe. So as you see, the stone is always at the 110. I'm sharpening the blade at 110 degrees on both sides. And that's the H67.
So we finished the most important in this section today, chapter. It is difference between the universal curettes and the area-specific curettes, and reduce the kit of Gracey Curettes and the modifications in the Gracey Curettes, including 15 on 16 and 17 on 13, and also the after 5 and the min 5 understood. All the modifications of the Gracey Curettes and important questions. Thank you for your attention and good luck.